Healthcare in rural Saskatchewan is looking grim these days as communities such as Shaunavon are short upwards of 3 nursing staff and now the departure of a doctor. And Maple Creek continues to operate with a shortage of 2 physicians. The issue surfaced over the Easter weekend again with the need to close both community hospitals, and at one point in time even overlapping with each other.
And in the end, what ended up happening was 2 of our shifts were being covered by the nursing agency out of Calgary that we've been using. And it wasn't until late Wednesday that they advised us that they had not sent in a piece of documentation to the Nursing Association, and the person they had scheduled to work in Shaunavon couldn't be licensed, and of course then couldn't work in the province that weekend. In Maple Creek, we had a locum physician who we had made arrangements with to provide the coverage, and at the last moment became ill. He himself was sick and unable to provide that. So, really we're grateful to one of our physicians, Dr. Govender in Maple Creek, who had not been scheduled to work, and he stepped up and was able to cover the majority of the weekend for us.
Vashon states the health region is continuing with its recruitment efforts for nurses and physicians, and is keeping the lines of communication open with affected communities, including a recent sit-down discussion with reps from Shaunavon, Frontier, East End, and Climax, and remains optimistic that all positions will be filled in the coming months, despite the uphill battle of recruitment and retention.
The people who we need to hire have to have the education, the experience, and they have to have a license from a professional association to be able to practice healthcare in this province. So I think our requirements and our rigor is a little stricter than some. Having said that, though, I know that all kinds of businesses right now are struggling to get the right staff on the ground with commitment to being part of their businesses. So we continue.
Meanwhile, for growing communities like Shaunavon, the frustration is mounting as local residents are unsure from a day-to-day basis of health coverage.
To be perfectly frank, Carol, it scares the heck out of me right now, and it's totally out of our hands as municipalities. This rests totally on the shoulders of the health region, and we'll expect them to resolve the situation appropriately and quickly.
And up the highway in Maple Creek, local residents are looking forward to the construction of their new integrated healthcare facility to replace the aging hospital. However, with the shortage of physicians and the recent disruption in service, a solution to the staffing issue would be welcome sooner than later.
I believe it's, really the provincial system that has to, we need to come to some sort of an agreement with our physicians or see or hire more or whatever it may take. And it's a cost thing, but it definitely doesn't do anything to give anybody any faith in our healthcare system, and especially here, being so close to Alberta. A lot of the people just naturally go to Alberta because you can't see a doctor here, so.
And as residents offer their concerns over the healthcare situation in public or through social media, health region officials remain steady with their course of recruitment actions, while welcoming any suggestions for hiring from local residents. A solution to the revolving door of healthcare workers needs to be rectified in the early stages, as patient safety and overall quality of care is at the heart of the matter. Southwest TV News will continue to follow this story as it unfolds.